I'm a 58-year-old male diagnosed with colon cancer. It was stage 2. I had a colonoscopy in 2021, had my surgery. Now I'm cancer-free. It's important to get your colonoscopy screening test because it's a matter of life and death. It's a genetic trait. I have 2 sons, and African American is higher, so I stay on them. I'll tell them, son, you need to go get this checked out. Your grandmother was diagnosed with colon cancer. I was diagnosed with colon cancer. It's a good chance that you are. The sooner the better. When you're 40 years old, African American male, plus you have a family history, those are three of the risk factors. So do it as soon as possible. Prevent is key. Is very important. I couldn't stress it enough.
For average risk patients, meaning no family history, no prior polyp in the past, you start screening at 45. Now that's a change in the last, let's say, 3 to 5 years or so. It used to be 50, but we're seeing younger and younger people with the disease, and so there's been general consensus that the age should be moved to 45. So now we start at 45. If at that first scope you have no polyps, in general, we say come back in 10 years, unless you have change in symptoms between that time frame. If you do have 1 to 2 polyps, then we tell you to come back in 5 years. 3 and more, we generally say come back in 3 years for that. So that's the general screening protocol for patients with polyps and colonoscopies. If you have a parent or a sibling who's had a history of cancer, you want to get your screening started 10 years earlier than when that family member was diagnosed. So if they had cancer at 50, you want to start at 40. If they had it at 48, 38. If you go 10 years earlier than the sibling or parent who had the cancer.